Unafraid workshop. Tonight we're talking about tough decisions in these tough times. You know, our church is so fortunate. We have so many members from our congregation who are doctors and nurses on the front lines in the hospitals every day, day in, day out. One of those nurses is Annette Wahl. Now, you know Annette if you've been in the hospital, because in these days when we can't go into the hospital to visit, Annette always sends me a text to say, who's in the hospital? And she will go and check on you. Even if she can't see you, she will check on you with the nurses at the nurses station and let us know he's doing better, he's okay. And when she can, she will go in and visit with you. Wow. What a great resource Annette has been to us and to our church and to our church family. But Annette called me a couple of weeks ago and she said, there's some information I really want to share with my church family. It's tough information, but these are tough times. So we begin tonight with this workshop, Tough Decisions in These Tough Times. Annette, I'll turn it over to you.
Hi, thank you so much for the chance to do this. I really appreciate it. I feel passionate about the opportunity to share information with you, especially in regards to our pandemic. It's important to know that most of us, if we do come down with COVID-19, we're going to recover. We'll have mild to moderate symptoms and expected to have a good recovery. But I also want to share my personal observations based on the work that I do at one of our local hospitals here. And I'm not intending to scare anybody, but I really want to impress the seriousness of what's going on and how to best prepare ourselves for anything that may come along. First of all, if somebody does end up hospitalized, that's pretty serious business. The hospitals right now truly are, as we see in the news, the hospital I work at, it does feel like a war zone in some sense. I never in a million years could have fathomed that the hospital could be like this. It's just unrecognizable, very, very intense, and full of so much sadness. We've had so many families that have had multiple members that have come down with COVID-19 and have died, or some of them, are still hanging on. We're waiting to see how they're going to do, but it's important to know that we're taking excellent care of our patients in the hospital right now. I truly do feel that, both the patients with COVID-19 and those without COVID-19. But I think that this is really an opportunity to start preparing ourselves and our families for something that could happen suddenly, out of kind of feeling like out of the clear blue, and could have some very serious consequences.
Thank you, Annette. This is really tough information, and we thank you for sharing it. I'll tell you what I'm thinking. I think we should first go to God in prayer. Will you join me in a quick word of prayer? God, we are so thankful for you. We are thankful for this day, and we are thankful for you being in the midst even of these tough conversations. I ask that you ease our minds, ease our spirits, and allow us to be able to fully receive that which you are giving to us in this moment. In Christ's name, amen. Amen. So, Annette, why don't you tell us more about what we might expect if any of our loved ones has COVID-19?
Yeah, so some things that we can do to be best prepared are to plan for the best possible care for you yourself. And this is kind of digging deep and taking a few moments to really consider what a serious illness could be like for you and how you would want us to handle your health care. We all have preferences, and this is really a time to talk to your family, or whoever it is that's close to you that could be helping you out with your medical decision making. I can tell you for myself, I come home and I watch the news with my family and I am tearful, and I take that as an opportunity to really talk to my family about, if this were to happen to me, these are the kinds of things that I would or maybe would not want to have done for me, depending on my situation and depending on what is offered to me by the healthcare team. So really tough discussions, tough to bring it up, but honestly, it's always tough. But right now we have it right in front of our faces. It's on the news, it's right there day in, day out, hour after hour, and it's probably never going to be easier to talk to your families about it, because it's potentially right there for any of us. I want to mention I've been talking to my mom. I have been talking to my mom through the years about what her healthcare wishes might be. If she develops a serious illness, she has done that in the past. A few years ago, she got really seriously ill, and that has given us opportunity to talk and reflect back on that. And now with what is going on, I talk to her most evenings and kind of talk about what is going on and what might make best sense for her care if, unfortunately, she were to come down with COVID-19. I hope this is not going to happen to any of us, but like I've said, it's important to think about. It's a way to be best in control if we become seriously ill and we're hospitalized. So yeah, I'm going to tell you some things to really be thinking about and some questions to be asking. But first of all, I want to mention what situations you could find yourself in, or somebody you're with, where you might be wanting to seek immediate medical attention. And I know you've heard this, but I'm just going to say it quickly again. If you're having difficulty breathing and it's feeling bad and scary and ominous, if you're having persistent chest pain or heaviness or pressure, tightness, something like that, if you're feeling kind of confused, or somebody's saying you're not acting right, or if you find somebody is sleeping and you're having difficulty waking them up and it just doesn't feel right, they're not mentally right. Or certainly if you notice somebody is having such difficulty breathing and they're kind of looking bluish around their face, their mouth, maybe their fingers, those are really serious things that you want to seek immediate attention for. So if somebody does end up in the hospital, some things that I would want you to know about is, first of all, communication, because that's going to start right away. Although it's all going to be on the phone, because there are no visitors in the hospital. Right from the emergency room door, it feels very strange and it is very scary. But nobody is allowed to come in and visit anybody in the hospital except under the most extenuating circumstances, which really are if somebody is dying and somebody's, actively dying, or if somebody's, maybe not able to speak for themselves, and that would really have to be considered. But I'm telling you, it's going to be communication that's going to be done over the phone with the family members of the patient, if the patient themselves are not able to clearly communicate with staff. The communication is going to feel pretty quick, direct, and it may feel very blunt. And so what you need to know to make sure you're understanding, get pencil and paper down right away to start making notes. You're really going to want to find out, how sick is this person? You're going to want to find out what is the prognosis for a meaningful recovery. And what does this mean physically able to recover, and move around and take care of our own personal needs, our personal hygiene, our cognitive functioning, our mental capacity, our ability to communicate, emotional recovery, because the hospital is a very lonely place. It takes so much stamina to recover from any serious illness, but to feel like you're there by yourself, you have to mentally and emotionally be in a really pretty good place to start out with. You want to find out when this person would be able to return home. What would it take to be able to return home? Is that a possibility, considering how ill somebody might be? And if somebody ends up in the ICU, each day in the ICU, each one day in the ICU, laying in that bed, takes many days of recovery, many days of really aggressive rehabilitation to recover. And some people want to also consider their family, and what does this mean to their family, and is this going to be a burden to the family? That's really, really tough to think about, but gosh, that's something that I hear with my work that I do during normal times. And this is really tough to ask, but really it's so important to find out what the doctors are thinking about how much time somebody might have. Tough to ask, tough to even begin to think about asking that, but that's what you're really kind of wanting to know. Some more information about being in the hospital. Depending on the condition of the patient, they will be placed in various settings in the hospital. So it might be that somebody is doing okay, and they're breathing on their own, and they're doing okay. They maybe just need the little oxygen prongs in the nose and just a little bit of oxygen for support, and they're breathing okay, and they're not in any imminent danger at the moment. We're going to monitor them, but just doing okay. It may be they're needing the next level of care where they're needing a little bit more aggressive measures of oxygen support. So with the COVID-19, what they're doing is they use two different forms of oxygen. One is with higher flow of nasal cannula oxygen, and then there's a mask that's put over that. So that's getting kind of more aggressive. And then there's where people end up needing to be in the ICU. And so what to expect if somebody's been in the or if somebody's going into the ICU, that's where we start talking about the ventilators that we all hear about. And ventilators are for oxygen support for people who are no longer able to adequately do that on their own. And that is with the COVID-19, because it's such a serious pneumonia that has developed. There may be becoming septic, and with the ventilator, there's a tube that is stuck into the mouth. It's about this thick. It's down in there, and then it's attached to a machine that is doing the work of breathing for the person. The person is sedated, and so they're not able to communicate with anybody. And they're restrained, so their actually wrists are tied to the bed because the natural inclination is to try to pull stuff off. So they're, this is serious business. If somebody's becoming more and more ill, more septic, the infection is taking over, the other organs in the body are going to be compromised. And it could be the kidneys. That's really very typical, and people then need to be on dialysis, where the dialysis machine is doing the function of the kidneys. Very big function with the whole dynamics of the body. It may be that the liver is beginning to fail. It may be that the cardiovascular system is beginning to fail, and they're needing some very aggressive kinds of medications that require high level of monitoring. Nutrition is at that point, if somebody's on the ventilator, there's a feeding tube that's stuck into the nose that goes down into the gastrointestinal system for nutrition. So really what I want to say is that these are very aggressive measures, which are, it's excellent, unbelievably beautiful care for people where we anticipate they're going to have a good, really good, meaningful recovery, a meaningful recovery for that person. I'm saying these very difficult things to all of you because I would rather that you begin to think about these things, hearing it from me, rather than first considerations being in the hospital in these very, very frightening kinds of settings. So if somebody is at this level of care in the ICU, that is a pretty good indication that there's a strong possibility this person may not be able to make it. They may not be able to recover at this point. The CDC has identified people who are at the highest risk of contracting COVID-19 and also the highest risk of poor recovery, poor outcomes. You've, I'm sure, heard this also. I want to just make sure you're all hearing it again from me. Those are older adults, people with serious underlying medical conditions. And those are hypertension, especially if it's not well controlled, heart disease, lung disease, smokers, people with liver damage, liver illnesses, people with diabetes, dementia, those who are immunosuppressed. That could be somebody with cancer who's recently undergone treatment, certainly somebody that's had a transplant of an organ, somebody who's obese, somebody with poor mobility, such as somebody who has suffered a significant stroke, or somebody who lives in a nursing home. I can't remember if I said somebody with dementia. If I did, I want to repeat that. Somebody with dementia, especially somebody with significant dementia. This is really, really tough stuff to hear. Going on with really tough information that I want you to hear about is that there are, as you know, many, many times where the healthcare team has unfortunately recognized that patients and families need to begin to start considering planning for the worst. It may be that this is the time that somebody is facing the end of their life and they're going to succumb to this very serious illness. We're hearing about these statistics all day long. These are people that are dying of this illness, and if the healthcare team is providing that information, it is based on medical knowledge, and this is not something that they have come to easily or lightly. This is something that they have given tremendous consideration for, and it's never easy information to accept or certainly to deliver. And this information at this point is not being based on rationing of care. We are not to that point. It is not being based on that. It is being based on medical information, and certainly based on those underlying medical conditions that I just mentioned. And like I said, this information could be coming very rapidly, and that could be because somebody's condition is deteriorating very rapidly. We certainly are seeing that, and I know you're hearing that in the reports as well. The other thing I want to mention is that going back to the importance of having these really tough discussions with your families or those who are close to you, that's because some of us may decide on our own, or it may be decided by the person that we've designated to make our health care decisions for us, based on conversations that we've had with them, that for you or I personally, those most personal, deep down considerations, that this would maybe more burdensome than beneficial to us. The burden may outweigh the benefit. And that's where you have to think about, what would this mean for you? And thinking about what would be the most acceptable outcome. What would you be willing to accept? What are your values, your most important values in life? You want to make decisions that are best for you. And if you have an advocate, hopefully you all have an advocate appointed to make a decision for you. That person needs to make the best decision for you, not for them, but for you. You're going to want to ask for honesty from the healthcare team. And I'm going to tell you, the nurses that are in the rooms with these COVID-19 patients, they are in those rooms with these patients 12 hours a day. They see what these patients are going through. It may be that you want to check with that nurse, because they really have their finger on the pulse of what's going on with this person. That'd be a really good person to talk to. Some of us may decide that this would just be lead to more suffering than would be worthwhile to me, as the body continues to decline, if that's the point that it's gotten to, if it's that serious of an illness, that the suffering would just not be worth it. The ICU level care, like I said, it's incredible, scientifically driven, well-researched, the very best level of care if somebody needs that level of care. But that's if we think somebody really is going to heal and recover adequately. And otherwise, it could be a whole lot of suffering with not the intended outcome that we were hoping for. This is really tough, but this is what we need to be thinking about. Some people may make that decision before they've ever even gone to the hospital, before they've had any symptoms of COVID-19. But they're thinking, my diseases are getting worse. Things have been going on. I'm concerned about it. It'd be a good time to call your doctor, especially if it's a doctor that you've been going to for years. You know each other well. Have a good, frank conversation over the phone. Many of them are doing that. Some of them are even reaching out to their patients to be proactive. Some people may come to a decision in the emergency room when they start hearing about this is what's going on, and if it's a serious illness, they may decide, right now I'm drawing a line in the sand of, you can try this or that, but if things get worse or if they get so serious, maybe I don't want those very aggressive measures in the ICU. And maybe I don't want somebody to try to restart my heart with CPR if it got to that point. So these are things to be thinking about and talking about. Some people may decide to give it a try in the hospital and see how things are going, and have whatever level of treatment is being recommended, and see how it goes. And based on how things are going, you may decide, I feel like this is working out and I'm making progress and I can keep going with this. You may decide that I'm getting to that line in the sand where I'm not going to want to keep on going with this. It's time to think about some other way of taking care of me. Some people may decide, or their advocate their family may decide, after some time in the ICU, well, this has now been enough. We don't see that there's some good recovery going on now. There's always going to be a way to provide care to every patient, and that is at any level, and that's including basic supportive care without the intention of curing the disease. So that could be that somebody's looking for some very good basic level of care, but not looking to try to cure the COVID-19. So if somebody has decided that they want to shift the focus of their care now, or if the healthcare team has unfortunately recommended it is time to make that transition to a different focus, and now it's time to begin to think about a comfort focused care. That care will depend on if somebody is at home or if they're in the hospital, and certainly going to depend on how sick the person is at that point. If somebody is at home and they're, doing okay, or maybe there's just so many other serious illnesses going on that it may be that after a discussion with their doctor over the phone, that they may decide, you know what, with all that is going on, going to the hospital if something comes up for me, it just does not make sense. I want to stay home. I want to get all the support that I can get in the home. And that may actually be time to ask about hospice care. I'm going to talk about that a little bit more in a minute too. If somebody's in the hospital and it seems like they're doing okay, it's not expected that they're going to have a good recovery and that they are going to succumb and die of this illness. If there's some time, then maybe it would make sense to try to get this person home so that they could have their last days in their own home if the family's able to take care of them. Lots to consider here. The other thing is if somebody's time really is quite short now, where we're thinking it could be hours to maybe days, then it's probably going to make best sense to have that person stay in the hospital now and provide the best care that we can for them. So some things to expect if we're taking a comfort focus is that we're going to ensure that the care is comfortable. This person is not suffering from shortness of breath, anxiety, pain, fear, those kinds of things. We're going to make sure we're giving them all the dignity that we can, all the most respectful kind of care that we can, keeping in touch with the family. Medications will be provided so that somebody is not suffering. And it's going to be medications based on what the needs are for this patient, not just randomly starting, high level of morphine and just pouring in the morphine. No, this is going to be based on what the needs are for this person and what is going on with them, what they need, and tailored to what their specific needs are. There's going to be lots of guidance given to the family or whoever the closest people are to this person so that they're kept well informed. Certainly spiritual support. I can tell you the chaplains in the hospital right now have just been so wonderful. They're using technology, they're using telephones that we're putting to the patient's ears for prayer and support, coming in the speakers at the bedside, just really very resourceful kinds of things going on. So that will not be forgotten, and I think that's important for all of us as a church family to consider as well. In the hospital that I work in, I said there's no visitors allowed. However, if somebody is in the active phases of dying, we are allowing 1 or 2 people to come in to be with them and to say goodbyes. As Pastor Myra mentioned a few weeks back, I thought it was such a lovely way to say it. I'd not heard this before. She mentioned that we're all perishable. Our bodies are all perishable. And that just really made me think, and that was before COVID-19. This all makes me think that we have one life to live. We need to live as best as we can, and that certainly includes living out our final hours and days and however much time we each have. And whenever our time does come, to do the best that we can so that we're unafraid, as our whole past few weeks have been telling us to do.
Thank you so much again, Annette, for all this information. I'd like to know, what should we be doing right now?
Now is really a good time to think about if you've ever prepared what we call an advance directive. Many of us have done this. Many of us have them kind of buried in a filing cabinet or buried in a binder from going to see an attorney at some point. But when an advance directive for our health care is talking about two different parts to an advance directive. The first part is what we call a living will. That gives some guidance, some direction to whoever may be making medical decisions on our behalf about how we would like our medical care to be delivered. How aggressive would we want medical care to be provided during certain circumstances in life. So that gives some guidance to the second part of the advance directive, which is the medical power of attorney. That's where we've appointed somebody to make medical decisions on our behalf only if we're ever unable to do that, such as if we're seriously ill with a COVID-19 infection. And that's somebody that we have appointed to make decisions on our behalf for what is best for us, not what's best for them, unfortunately. That may be somebody who would like to keep us around, but this is what's best for us. And that is based on lots of conversations that we've had during our good times when we're healthy and feeling well. So I mentioned many people have advance directives. If you have prepared one, dig it out and look at it and talk to your medical power of attorney that you've appointed. It's a good idea to ask that person to carry a copy of that with them in their purse, in their backpack, whatever. Certainly if somebody ends up in the hospital, right away that document needs to be provided to the hospital so it ends up in the medical record, so we in the hospital know who we would be talking to if this person is suddenly unable to communicate their needs and their requests for their medical care. If you do not have an advance directive prepared, we're going to have one posted on the website, the church's website, rofum.org, a link to one. There's also so many different documents that you can find online for free. Normally, the documents require 2 witnesses to your signature. I can tell you the hospital that I work at right now, because of the extenuating circumstances right now, this is not how it's going to be forever. It never has been like this before. But if we have a document signed by the patient but not witnessed, we're going to use that as guidance. So if you've gotten that far with a document and you end up in the hospital, please bring that with you. So again, this is all about what is best for us. This is the most personal thing that we can do, is be thinking about how we would want medical care to be delivered to us if we're seriously ill. What's best for all of us right now is for everybody to stay hunkered down at home. Stay home, stay safe. Our governor extended that today through April 30th. I also want to say I think it's best for all of us to get a breath of fresh air. If you go out on your front porch, if you see your neighbors out, if you're in your backyard, keep moving around, do exercises at home, turn on music, dance, just keep moving. That's good for us from head to toe. Eat right, eat well, enjoy a treat now and then. I'm going to dig out some old cake mixes I have buried in the pantry and make a cake and think about how much of a treat that is right now. Enjoy things the best that I can. Take care of yourselves emotionally. Very, very important right now. The governor today mentioned there's a national distress hotline number. I'm sorry I don't have that number handy, but maybe that's something we could post as a link on our website. You could find that on the internet. And certainly stay connected with your church, our church family. And I miss so many of you. I just keep on thinking about the people that I love in our church and the people that I'm so accustomed to seeing on a regular basis on Sunday mornings. And even if I don't talk to you all the time, I see you and I'm thinking about so many of you right now, and I wish you the very, very best. Please take very good care, and thank you for this opportunity.
Thank you, Annette. Wow. I know those were tough things for you to say. They're tough things for us to hear. But let me tell you, these are tough times. Thank you, Annette, for your dedication to your church family, for your bravery and your dedication to your church family and to the world. Oh, what good you bring to this world. I want to tell all of you listening, if you had questions about some of the things you heard, please feel free to email those questions to me, mmoreland@rofm.org. And Annette, I will send them to Annette, and we will come back on in another live stream and answer as many questions as we can. So if you have questions about anything that you heard, please send them to us, mmoreland@rofm.org, or to just the church website is fine. Thank you for being with us tonight. It takes bravery to listen to some of these things. These are difficult times, tough times. There could be tough decisions, and it's always better to be informed, to know ahead of time what we can expect. So we will close this evening in prayer. Gracious God, first of all, we lift up Annette and all of those nurses and doctors in the hospital who see patients every day in this COVID-19 crisis that we are in. Be with them, keep them safe, keep them healthy, give them courage and strength. I know it is exhausting. Please be with each and every one of them. We lift them up for your blessing. Be with all of us who heard this message tonight. We heard these tough words. Oh, this is hard to hear sometimes, God. And yet we know through all of this, you are with us. You will comfort us and guide us. You will lead us through this tough time. So God, we ask you tonight, oh God of comfort, comfort us. Comfort all of those who are ill, all of those who have loved ones who are facing illness. Be with us and guide us. It is in the name of Christ that we pray. Amen. Thank you for joining us. Peace be with you.